All right, so the question came in, is there a difference between being borderline diabetic and having actual full-blown diabetes? The answer to that question is depends. Being borderline diabetic, in the traditional sense where that term is being thrown around, is that you have a couple of measures that are kind of right on the edge. So borderline being hemoglobin A1c, which is the blood test that tells us how good the blood sugar is done over a consistent 3-month period of time. If that A1c number is over 6, then we start scratching our heads and looking at things a little bit more intensely. Certainly if it's up over the 7 or even over 8 range, that is going to be diagnostic for having diabetes. The other blood test is your fasting blood glucose, FBG, and that number, if it's consistently up over 120 to 130, 130 to 140, then that we also are thinking the same things. We're thinking, okay, well, this patient we got to keep a close eye on. They are at higher risk of having diabetes. Now, we've heard that term being associated with somebody that had never had a previous issue with blood sugars or a high hemoglobin A1c, but they all of a sudden get a blood sugar or an A1c up over 11, in the 10 or 11 or 12 range. That, my friends, is absolutely diabetes, especially if you're having other symptoms. If you're having issues with your with kidneys or your vision, or if you're having, in our case, you're having problems with numbness, tingling, pins and needles, burning, aching or cramping, all of those also point to potential neuropathy, which is diagnostic really for high blood sugars or patients that have diabetes, that the blood sugars have been so high for so long that they're causing issues as well with the nerves in the feet. And so that is my answer to that question. What's borderline versus regular diabetes?